Hi, I'm Alex Lesiuk, student nurse, University of Manitoba, and I'm going to be demonstrating intramuscular injections today. So we'll review to get started the date and time. It's February 7th, 2021. The time is 20:30, and we are going to be giving medications. So first off, we're going to compare the physician's orders and the medical administration record. So we have nursing Jake, that's right, patient, nursing Jake. Date of birth, January 1st, 1960. Our patient has no known allergies, and all of our orders are properly transcribed and double signed. We are going to be giving medication for uncontrolled nausea secondary to chemotherapy. So now we are going to compare our medication. We got the right drug is metoclopramide. The right dose is 5 milligrams. The right route is subcutaneous, subcut. The right time and frequency is daily. It is given once at 0800 hours. That has already been given today, so we're not going to worry about that. Next we have diamond hydronate. It's the right drug. Right dose is 150 milligrams. Right route is IM, that's intramuscular. Right time and frequency is daily. It's given once daily at 2100 hours. It is now 20:30 on the 7th. It hasn't been given yet today, so we are going to give that drug. So now I'm going to find my medication. So here we have diamond hydronate. For injection, it says it comes in 50 milligrams per ml. We need a dose of 150 milligrams, so we're going to be drawing up 3 ml. It says for IM or IV use, and this is not expired. This vial is in fact not expired either, so that's safe to give. Now we will review our parenteral drug monograph. So we have diamond hydronate here. It's an antiemetic. Gravol is another name for it. The max single dose in the day is 100 milligrams. So we notice this discrepancy on the MAR here. It says to give a dose of 150 milligrams. We have called the pharmacy and called the doctor as well, and they said that it would be okay to go ahead and give that dose. They've confirmed for us, so we are going to continue with that as normal. So some information about this drug. So diamond hydronate is an antiemetic. It works by blocking the H1 receptors in the vestibular system. Some adverse side effects of this medication include drowsiness, constipation, and blurred vision. Contraindication of this medication include hypersensitivity, nursing mothers, and people with asthma. Drug interactions include increased sedation when taken with anticholinergics and other central nervous system depressants such as opioids and alcohol. Some nursing implications include assessing the patients for nausea and vomiting, assessing their ins and outs, their vital signs, and any hypersensitivity or signs of dehydration. So once we've done that, I'm going to do some hand hygiene. I'll take an alcohol swab, open that up, and I'm going to clean off the top of the vial for 30 seconds. In a circular motion. So we'll say that that's 30 seconds. While that's drying, I'm going to collect my supplies. So we've chosen a 3 ml Lesiuk sterile syringe. That will be appropriate, and we've chosen a 22 gauge 1.5 inch length needle. So we know that that will work appropriate as well, because intramuscular injections can have between 22 to 25 gauge and between 1 or 1.5 inch length. And I will grab a blunt fill as well. So I'll do hand hygiene again, and we're going to wing back our syringe. Just pull that out, throw that in the garbage. We're going to wing back our blunt fill, attach that, maintaining sterility. We're going to set up our syringe with 3 mLs of air, and then we are going to inject into our vial, inject the 3 ml to set up a pressure system, and then I'm going to let the pressure fill our vial with a little bit of help. I'm going to pull out a bit extra so we can tap the bubbles out. Once I'm sure I have enough, I'm going to pull that out and do our scoop method. Now I'm going to tap any bubbles out and calibrate our needle. Pull back on the plunger, make sure everything is out of the blunt fill. And I will remove our blunt fill and throw that in the sharps disposal, and appropriately wing back our injection needle. And attach that to the sterile hub. Throw that in the garbage. And now I'm going to calibrate and prime our needle. So I'm going to do this over the med waste. And there I'm at 3 ml with our needle primed.
Good.
So right after that, I'm going to create a label for our drug so we have the right patient. Nursing Jake. Drug name is DIMENHYDRINATE, and it's for IM, so I'll add that in as well. Dose is 150 milligrams. Volume is 3 ml. Concentration per ml is 50 milligrams per 1 ml. Date and time, it is February 7th, 2021. The time is 20:30, and my signature. So once I'm done that, I'm going to right away attach that label to the end of our syringe. And now I am okay to do our second check. So we're going to bring the MAR, our label, the vial, and our syringe together. So here we have the right patient, Nursing Jake. Nursing Jake, the right drug is dimenhydrinate. Here's dimenhydrinate. The right dose is 150 milligrams. Here we have, this comes in 50 milligrams per ml, so we have 3 ml. So here we have our 3 ml, and I'm checking to make sure we do in fact have 3 ml with no bubbles. The right route is intramuscular. So this is appropriate to give intramuscular, and this is our intramuscular injection needle, so that is appropriate as well. And we have reviewed with the pharmacy that this dose will be appropriate to give. And the right time and frequency is daily. It's given once daily at 2100 hours. It is now 20:30 on the 7th. It hasn't been given yet today, so we are going to give that. So now I'm going to put my vial away in the appropriate med room spot and make sure to leave no meds unattended, dispose of my garbage, put my blunt fill in the sharps container, and I'm going to collect my supplies, which are clean gloves, alcohol swab, cotton ball, my syringe, something to sign with, and my MAR. So I'm going to do hand hygiene before I leave the room. Upon entering the patient's room, I'm going to do my entry safety check and everything that entails. So the bed in the lowest position, the call bells within reach, side rails are up, and the patient's in no immediate distress. Then I'm going to introduce myself with my name and designation. So hi, I'm Alex Lesiuk, student nurse at the University of Manitoba. I'm going to be doing your intramuscular injection today for you. Could you just verbally verify your name with name and birth date? So after I get verbal confirmation of who they are with their name and birth date, I'll compare their name and birth date to the MAR here. So we got Nursing Jake, January 1st, 1960, January 1st, 1960. And do you have any allergies, sir? He says no known allergies, so that matches our MAR. So just excuse me for a second while I do my third check at the end of the bed here. So now I'm going to do my third check here. So we got the right patient, Nursing Jake. The right drug is dimenhydrinate here. Here's our dimenhydrinate. The right dose is 150 milligrams. So we know that it's 50 milligrams per ml. So we have 3 mLs here, and I'm making sure we do in fact have 3 mLs with no bubbles. The right route is IM, that's intramuscular. This is our intramuscular injection needle, so that's appropriate as well. Time and frequency, the right time and frequency is daily, given at 2100 hours. It is now 20:30 on the 7th. It hasn't been given, so we're going to give that drug. So next I'm going to explain the procedure to the patient. So today we're going to be doing your intramuscular injection of your dimenhydrinate. So that is an antiemetic. It's going to be a needle that goes into the muscle tissue, and that is going to hopefully help your nausea and vomiting secondary to the chemotherapy. So we have chosen the ventrogluteal spot, and the patient is in agreement with that. Before I give this medication, I'm going to be assessing your vital signs, your ins and outs. I'm going to be assessing your level of consciousness, as well as any sign of allergic reaction to anything. And I'm going to be letting you know about some possible side effects. So some side effects may include drowsiness, constipation, blurred vision, or tachycardia. If you experience any of those, or just want me to come assess, I will come and help you out with that. Just ring the call bell. Some nursing education I would provide with this medication includes take this with a meal in your stomach. It's best with food in the stomach, and don't operate any heavy machinery or vehicles because it does have a drowsy effect, and don't take with alcohol. So landmarking this site, I'm going to choose the ventrogluteal spot. So the ventrogluteal, we're going to have the patient expose his left hip, and I'm going to use my right hand to landmark with my palm on the greater trochanter and my middle finger towards the iliac crest, index finger towards the iliac spine, and thumb towards the groin. And we're going to find the squishy muscular portion in between my middle finger and my index finger, and I'm going to mark that with the alcohol swab so we know exactly where we landmarked. So I would position the patient appropriately with the bed at the appropriate height and maintaining dignity. So after I do that, I'm going to mention our hospital's policy on aspiration, so we don't need to aspirate per our hospital policy. As well, then I'm going to do hand hygiene. I'm going to put on clean gloves. I'm going to open our alcohol swab. I'm going to sanitize in a circular motion for 30 seconds. And then this is how I would landmark. So we would make sure we would inject right there. So we'll say that's 30 seconds. And for intramuscular injection, we'll make sure to inject at a 90-degree angle. And I'll let my patient know that we are going to be injecting now. So you will feel a poke. And I'm going to Z-track and then inject at a steady pace. I'm going to stabilize and then inject the medication at a safe and steady rate. Once all the medication is injected, I'm going to hold it there for a couple seconds, remove my fingers, remove the needle, and let go of the Z-track. I would activate my safety mechanism, but for this video purposes, I'm going to put that over there, and that will go in the sharps container. After that, I'm going to hold a cotton ball to the site for 30 seconds, making sure to get any blood or anything, not massaging the site. After that, I'm going to remove my gloves and put those in the garbage, do hand hygiene, and I'm going to document on the procedure. So we have, it is 20:30, and in clinical settings, I would make sure to document with a pen. We are just doing it with pencil because of this specific circumstance. So after that, I would make sure that my patient is comfortable in a safe position, call bells within reach, beds in the lowest position. They no longer need anything. I would do my exit safety check, and I would make sure to explain to the patient nursing implications, such as we're going to be looking out for their vital signs. We're going to be assessing for therapeutic effect of the medication we just gave. So a solution to their nausea and vomiting because of the chemotherapy. We'll be assessing their ins and outs, and I'll make sure that they're comfortable. I'll do my exit safety check, leave the room, and then I will document in any procedural documentation that the hospital requires, such as nursing IPN or any other procedural paperwork. That's it.